And when you look at these various assets at HHS, you really do get a sense of a whole government approach. It's not just foreign assistance, it's certainly not just diplomacy, it's also the broad spectrum of engagement in the science and the delivery of global health and global health technologies. As an example, the National Institutes of Health, which currently has a budget of $32 billion, an enormous part of our national investment. In AIDS alone, is spending $450 million a year in global AIDS research, not domestic AIDS, but global AIDS research. And while the columns haven't really been totaled up in a consistent way, yet our estimate is that the total NIH investment in global health is on the order of $700 to $800 million a year. The Centers for Disease Control and Prevention, which some would call the crown jewel of the U.S. public health system, is currently working in more than 80 countries, carrying out epidemiology and response, and deeply engaged in healthcare needs on the scientific and public health side. Recently, the Food and Drug Administration has become deeply involved in global health issues, initially because of the importance of protecting the health of Americans because of food and pharmaceuticals that come into this country from outside our borders, but increasingly now the recognition that in a globalized world you need a globalized regulatory process so that you don't have to reinvent the wheel every time you're trying to get approval for a drug or a diagnostic. So going back to my first questions, who am I, what am I doing here? The same thing can be said for the issues of illness and health. What are they? How do you find out what someone has if we don't have good diagnostics? And clearly the needs for rapid diagnosis of things like malaria and TB are critical. We need to make sure that we can treat the right things and mitigate or altogether cure various diseases. And today we have antiretrovirals, which were developed largely through NIH grants in the 1980s and 1990s. We have a wide range of antibiotics, which have some been developed through NIH processes, and then all of them taken to wide-scale market by private industry. We recognize that if we had today all the drugs and antibiotics that we needed, we could simply let these loose upon the world, but I think it's fair to say that anything that's currently being used as an antibiotic or an antiretroviral is likely to be a shelf relic in about 15 years because of the rapid emergence of resistance. So this is an ongoing issue of essential research. And then thirdly, how do we prevent these diseases and these conditions to begin with? Clearly without the developed research and development into vaccines, the vitally important area of microbicides is a way of preventing the spread of HIV to women. Behavior change research, which is a growing concern across the Department of Health and Human Services, and the development of increasingly effective and women-controlled contraceptives and ways of managing their own fertility so that they do not become pregnant if they don't wish to. These are all vital issues in which the Department of Health and Human Services, working with our partners at USAID, State Department and others, have enormous investment and enormous contributions to make. It is a terrifically exciting time in the field of global health. We have enormous progress to build on over the past 15 years, but there's a very strong feeling that the next 5 to 10 years is really going to bring about a revolution in the health of the world's poorest 2 billion people.